If I told you that the latest frontier in wellness involved taking highly purified DNA fragments extracted from trout sperm and then micro-injecting them into your most intimate areas to reverse aging, you'd probably assume I was pitching a bizarre science fiction movie.
Oh, absolutely. I mean, it sounds completely absurd on its face. Just the imagery alone is, a lot to process.
Right. But it is very real, and it is completely revolutionizing intimate wellness. So, welcome to this deep dive. Today, we are unpacking the wild and fascinating world of intimate polynucleotides.
It's such an incredible topic, and I'm really glad we're getting into the specifics
Me
today.
too. Because, we've seen celebrities praise polynucleotides for the face to get that flawless glass skin complexion. But the science has, well, it's moved south.
It has. We're talking about utilizing these injectables for non-surgical, non-hormonal tissue regeneration in the vulvovaginal area.
Exactly. But anytime we talk about an intimate procedure, the biggest, most glaring question for you listening isn't usually about the result. It's about the reality. Like, what does the downtime actually look like?
Yeah, that is the crucial blind spot for so many people. You see the glowing before and afters in clinic brochures, but the actual recovery, the unglamorous, messy middle part, is frequently just glossed over.
Which is exactly why we're here. Today's mission is to give you a clear day-by-day roadmap of the recovery process.
Right. We're going to explore the strict rules of this downtime and really look at the actual science of how your tissue is healing when you walk out the clinic door.
So, to understand the recovery, I feel like we have to start with the substance itself. Brands like Nugent or Vitarin use these polynucleotides, which are essentially long chains of DNA building blocks. But, and I have to ask the obvious question here, why fish?
It's a fair question.
Like, of all the biological materials on Earth, why are we using the genetic material of salmon and trout?
Well, it comes down to a startling biological reality. Fish DNA is actually incredibly biocompatible with human DNA.
Wait, really?
Yeah. The genetic base pairs are structurally very, very similar to our own. But I should clarify, you aren't actually injecting fish cells into your body.
Okay, that's a relief. So what is the raw material then?
Right. So the raw material goes through an intense, patented, high-heat purification process.
Meaning they strip away everything that essentially makes it fish?
Precisely. The proteins, the lipids, all the cellular components that would normally trigger your immune system to attack a foreign substance, those are completely obliterated.
Wow, okay.
Yeah, so what you are left with is just the pure, naked structural backbone of the DNA. It's essentially a universal biological building block.
So how does a pure DNA structure actually fix intimate tissue? Because traditional injectables like hyaluronic acid fillers, they're pretty straightforward.
They are very straightforward.
Right. They act like a sponge. You inject them under the skin. They hold on to water. They plump up the area, and that's it. You're just adding volume. But the clinical guides describe polynucleotides entirely differently. They call them biostimulators.
Yeah, the difference in mechanism is profound. Hyaluronic acid is passive. It sits there, it pumps, and eventually it just dissolves.
Like spackling a crack in a wall.
Exactly. Great analogy. But polynucleotides are active. When they are injected into the tissue, they actually bind to specific receptors on your cells.
Oh, so they're communicating with the body.
Yes, they send a chemical signal that literally wakes up your fibroblasts.
Okay, let's give a quick definition of fibroblasts for anyone listening who isn't familiar, because that seems to be the star player here. What is that cell actually doing?
Think of fibroblasts as the microscopic manufacturing factories inside your skin and mucosal tissue. When you are young, those factories are working overtime.
Just pumping out collagen and elastin.
Right, collagen for structure and elastin for that stretch and bounce. But as we age, or, go through hormonal changes like menopause, those factories essentially shut down.
And that's when the tissue gets thin, loses elasticity, and gets painfully dry.
Exactly. So polynucleotides walk into the factory, flip the master power switch back on, and tell the fibroblasts to get back to work.
That is wild. Now, the literature also highlights a process called angiogenesis. And from my understanding, angio means vessel, and genesis means creation. Are we literally building new blood vessels down there?
We are. We absolutely are. And that is what makes the recovery so intensive. Polynucleotides stimulate the sprouting of tiny new capillary networks.
Okay, and more blood vessels mean more oxygen and nutrients delivered naturally.
Exactly, which restores natural moisture and thickness without relying on an artificial gel just sitting there.
But, okay, here's where it gets really interesting. The delivery method for this biological wake-up call involves needles,
Yes, it does.
The procedure takes about 10 to 20 minutes, uses a topical numbing cream, and involves multiple, very superficial microinjections into the vulva, the labia, or the vaginal walls.
That's the standard protocol, yes.
Wait, I need to back up. If we are intentionally waking up the immune system and the repair cells with these DNA fragments, and we are also stabbing the tissue with needles, aren't we just causing a massive trauma response?
You've hit on the exact reason the downtime exists. You are intentionally creating a controlled inflammatory response,
Okay, so it's on purpose.
entirely on purpose. The mild mechanical trauma of the needle piercing the skin, combined with the intense cellular signaling from the DNA fragments, well, it rings a massive biological alarm bell in the tissue.
Because you've just triggered this massive biological traffic jam, the first 72 hours become a physical tightrope for the patient.
A very delicate tightrope.
Let's talk about what the patient actually feels when they go home and that numbing cream wears off.
Physically, the first 12 to 24 hours are the most intense. Your body is flooding the area with plasma, white blood cells, and nutrients.
So lots of swelling, I imagine.
Oh yeah, you will experience mild to moderate swelling. The area will feel tender, heavy, and you will likely see redness. But the most surprising physical symptom for patients are the papules.
Wait, papules, are those basically just small bumps under the skin?
Yeah.
What is structurally causing those bumps? Is it the body reacting or is it the product itself?
It is actually the physical product. The polynucleotide solution is this viscous, honey-like gel.
Okay.
And because the practitioner is injecting it very superficially, right under the surface of the skin where those fibroblasts live, the gel doesn't just instantly vanish.
Ah, got it.
It sits there in these tiny little reservoirs, creating visible bumps. Your tissue needs time to slowly absorb those DNA chains.
Since the body is actively flooding the area with blood and the gel is just sitting below the surface, the clinics lay down some incredibly strict rules for these first 3 days.
Very strict.
The most prominent is the no friction rule. Absolutely no sexual intercourse or intimate activity for 48 to 72 hours.
And some practitioners even advise waiting up to a full week.
Wow. And it extends beyond intimacy, too. You are banned from biking, spinning classes, and horseback riding.
Yes, all of the above.
Okay, let's unpack this. I get the no sex rule immediately after having needles in a highly sensitive area, but spinning, why does a stationary bite ruin the treatment?
Well, think about the physics of a spin class. You are applying intense, localized body weight directly onto a tiny saddle, focused entirely on the vulvar area, right?
Right.
And you're pedaling to create repetitive, aggressive, shear stress. The cells in your tissue are actively trying to lay down a delicate new scaffolding of collagen. Friction physically tears that microscopic scaffolding apart before it can even set.
Oh, wow. So you're basically bulldozing the construction site
Exactly. And even more critically, it's a massive infection risk.
because of the needles.
Yes. The vulvovaginal area already has its own complex, delicate microbiome. The microwounds from the injections haven't fully sealed yet.
And then you add heavy sweat and tight workout clothes.
Right. When you add heavy sweat, intense body heat, and friction, you're creating a slip and slide for bacteria to enter those fresh injection sites. You are completely bypassing the skin's natural barrier.
Yikes. That makes the no heat rule make perfect sense, too. The aftercare guides are adamant. No saunas, no hot tubs, no steam rooms, and no excessively hot showers for that same 72-hour window.
Exactly, because heat causes vasodilation. Your blood vessels naturally open up and expand to release heat and cool the body down.
And we just discussed how the injections intentionally cause a rush of blood to the area.
Right, to start the healing process. So if you jump into a hot tub, you are opening the floodgates. You will exacerbate the swelling from a mild, controlled response into a highly uncomfortable, throbbing pressure.
That sounds awful.
It is. And again, sitting in communal warm water with fresh puncture wounds is basically an open invitation for a bacterial infection.
So the hygiene and clothing protocols are entirely designed around protecting that fragile state. Patients are told to wear loose, breathable cotton underwear, avoid tampons, use only mild, fragrance-free, intimate cleansers.
And there is a massive warning that we have to emphasize.
What's that?
Whatever you do, do not touch or massage the area. Do not try to rub the bumps away to make it look smooth.
Just leave it completely alone.
Yes. You have to let the product integrate on its own timeline. If you massage the area, you risk pushing the gel out of the precise superficial layer where it was placed. Or worse, you introduce bacteria from your hands directly into the healing tissue.
Okay, so let's say you clear that strict 3-day hurdle. You can take a hot shower again, you can put your normal clothes on, you can resume intimacy. Is the downtime completely over, or is there a secondary phase of recovery happening behind the scenes?
That is the grand illusion of regenerative aesthetics.
Oh.
Yeah. The visible restrictive downtime ends, but the biological downtime is just hitting its stride.
The timelines in the clinical literature for days 4 to 14 are genuinely fascinating. Even though you are back to your normal routine, you will still have lingering signs of the procedure.
You definitely will.
Pinprick marks or tiny scabs might be visible for up to 5 days. But the real wild card here is the bruising.
Bruising is an unavoidable reality anytime you introduce a sharp needle into a highly vascular area like the pelvic floor. There is just a dense network of capillaries down there.
But what always surprises people is that while the swelling usually resolves within 2 days, the bruising actually looks worse on day 2 or day 3.
Yeah, it does.
Why does a bruise down there take 10 to 14 days to completely fade away? What is biologically happening to that trapped blood?
So when a needle nicks a tiny capillary, blood pools in the extracellular space under the skin. Your body recognizes that pooled blood as debris that needs to be cleaned up.
Oh.
It sends in macrophages, which are essentially the garbage truck cells of the immune system, to break down the hemoglobin in the blood.
And that changes the color.
Exactly.
Yeah.
As the hemoglobin is broken down, it changes chemical structure and color. It goes from a deep purple or red to biliverdin, which is green, to bilirubin, which is yellow.
Oh, wow.
And because gravity pulls that pooled blood down, and because the tissue in the intimate area is so soft and porous, it literally takes the macrophages a full 2 weeks to completely dismantle and cart away the debris.
Which introduces what we should probably call the mental downtime.
I like that term, mental downtime.
Because you have to wait for the macrophages to clear the bruising, and you have to wait for the fibroblasts to build the collagen. Patients are strictly advised not to judge the results immediately.
Right. Unlike a hyaluronic acid filler, where you look in the mirror and instantly see a plumped-up result, polynucleotides are playing a very long game.
So what does this all mean for the listener? It sounds like you need some serious patience.
You really do. Noticeable changes like improved natural lubrication, reduced pain during intimacy, and tighter, thicker tissue take weeks to appear. You are relying entirely on the skin's natural cell turnover cycle.
And the literature consistently shows that results don't peak until around 10 to 12 weeks.
Exactly.
It's essentially like planting a garden or maybe pouring the concrete foundation for a house. You can dig the hole and pour the cement in one afternoon, but you absolutely cannot build the walls the next morning.
No, you can't.
The concrete has to cure deep underground. You might just see a flat, boring slab of gray rock for weeks, but underneath, a structural transformation is locking into place.
That is a brilliant way to conceptualize it. Managing your own expectations is a massive part of this recovery. If you expect a fully built house on day 3, you're going to feel anxious and disappointed when all you see is swelling and a yellowing bruise.
Right.
You are investing in long-term architectural repair. And furthermore, it isn't a single pour of concrete. A patient usually needs a course of 3 to 5 treatments spaced 2 to 3 weeks apart to fully stimulate the tissue.
Wow. But with all this intentional swelling, the chemical color changing of the bruises and the bumps under the skin, it brings up a very practical concern.
Which is?
Dealing with intimate areas naturally makes people anxious. If you see a weird bump on your arm after a flu shot, you might just ignore it, but a weird bump down there might trigger absolute panic.
That is completely understandable.
How does a patient distinguish between curing concrete and a total structural failure? How do they know if they are having a normal recovery or an actual infection?
The defining metric is the trajectory of the symptoms.
Trajectory, okay.
The golden rule of any aesthetic recovery is that symptoms should become progressively less noticeable over time. Normal recovery means the swelling peaks at 24 hours and slowly recedes. By day 5, the tenderness should be fading to a dull ache, if anything. The body's finding its equilibrium.
So a red flag is anything moving in the opposite direction.
Absolutely. True infection is angry and aggressive. The papules we discussed earlier, the little reservoirs of gel, are painless and simply slightly raised.
And they fade quickly.
Right. They usually absorb and flatten out within 3 to 12 hours, sometimes a bit longer depending on your tissue density. But an infection behaves entirely differently.
What does that look like?
It brings localized, radiating heat that you can easily feel. It brings spreading redness that expands outward and a throbbing, worsening pain that hurts even when you are sitting completely still.
Ouch.
Yeah. If a bump is getting hotter, redder, and more painful on day 4, that is not the product absorbing. That is a bacterial issue.
The aftercare guides list a few other immediate warning signs, too. Any pus or oozing from the injection sites, or unusual color changes, like the skin turning gray or white, which can indicate restricted blood flow.
Yes, those are serious red flags.
If any of that happens, the protocol is to contact the clinic immediately.
I always implore patients to advocate for themselves. Practitioners would much rather you call them to ask about a bump that turns out to be nothing, rather than sit at home letting an infection take hold because you felt embarrassed.
Oh, that's such good advice.
It is their clinical responsibility to guide you through the downtime safely. Never hesitate to call.
There is also one major non-negotiable contraindication we have to mention before we wrap up.
Yes, the allergy risk.
Anyone with a fish allergy should absolutely not have this procedure. Even though the DNA is highly purified and the proteins are stripped away, the base material still originates from trout or salmon.
Exactly. Avoiding the treatment entirely if you have a known allergy is the only way to prevent a severe systemic allergic reaction.
Better safe than sorry. Safety always has to precede aesthetics. It is a strict boundary in the clinical guidelines.
So, to synthesize all of this, intimate polynucleotides offer some genuinely incredible science fiction level benefits. They are literally regenerating degraded tissue, naturally restoring moisture, and rebuilding capillary networks using the fundamental building blocks of DNA.
It really is remarkable technology.
But the cost of those long-term non-hormonal benefits is a strict initial downtime. You are looking at a 72-hour period of hands-off, no heat, no friction recovery. No spin classes, no hot baths, no intimacy, just loose cotton underwear and time.
Followed by weeks of profound patience as the bruises chemically break down and the fibroblasts do the slow, invisible labor of rebuilding the tissue scaffolding.
Being well informed about the messy, unglamorous side of these procedures is your ultimate tool. You don't have to panic about a bump or a yellow bruise if you know exactly the biological mechanism causing it. This deep dive does raise a profound question about the future wellness, though. Yeah. We are now at a point where science allows us to literally inject the purified building blocks of DNA to turn back the clock on cellular aging in our most private areas.
It's still hard to wrap my head around.
I know. But how is this going to shift our cultural acceptance of aging itself? If we can regenerate tissue on a fundamental cellular level, will we eventually view tissue degradation anywhere in the body, not as an inevitable, irreversible fact of getting older, but simply as a treatable condition?
Wow. Yeah, let that thought linger the next time you hear about the latest aesthetic breakthrough. For you listening, until next time, keep digging deeper.